I'm Szenan from Self-Balance, the acupuncturist. Now, today our topic is what causes hot flushes. Now, if you join in now, whether it's a playback one or live, please say hello to me and then give me a thumbs up and share this live video as well. I'm going to share. I'm going to go to the Facebook to share as well. I will watch live video. Let's see how I do that. Okay, I'm also going to Instagram of mine and my private Instagram to share this video as well. Okay. Hi, Veronica. How are you? Thank you for joining us. Thank you. So we have more people join us on Facebook. Thank you for joining us. Okay. Right. Hi, Kate here. Nice to meet you. Thank you for joining us. Now, let's start the topic today. Our topic today is what causes hot flushes. So leave your comment down there if you suffer from hot flushes. Please describe what is your symptoms and how often and how severe is your hot flushes and what sort of treatment are you currently taking that deal with your hot flushes and whether it helps or it hasn't been working. I would like you to share it with me. So today we're going to focus on what causes hot flushes. But to be honest, okay, it's not exactly clear in the Western medicines. Okay, it's not exactly clear what causes hot flushes, but multiple studies are attempting to understand them. There is clear evidence that hot flushes result from hormonal changes in the body, right? So this evidence has been focused on menopause, okay? So the connections to other health problems such as diabetes. So diabetes can cause hormonal change, right? There's a hormonal change issues, disease. So diabetes is also being studied, right? And obesity and metabolic symptoms are thought to increase the incidence of hot flushes. Well, we mentioned that yesterday. Menopause cause hot flushes, right? Because the hormonal change. But I want to tell you one thing. Some women barely notice hot flushes. So which telling us that hot flushes symptoms is not normal. How people think, oh yeah, I got menopause and the hot flush is normal. No, it's not normal because some of them manage it very well. They don't get hot flush at all, which means when the hormonal change, it shouldn't. It's gradually decrease, and you shouldn't have any symptoms, the hot flashes. Okay. So some very notice hot flashes, and for others, or majority, the the hot flash intensities may affect their quality of life in a negative way, right? Because it make you moody, and then it make you frustrated, it make you annoying, and you get grumpy easily, or make it pain. We talk about that. The first doctor that found out that the menopause is actually through pain, because most women come to menopause, they suffer from shoulder pain. So we know that hormonal change it actually causes pain as well. Okay, so hot flashes can come with sweating, pain, emotional, grumpy, frustration, annoying, depression, anxiety. Right. Let's let's talk about menopause, because we know when it comes to menopause, you get hot flashes. Now, menopause is actually a natural process that occurs as the ovaries age and produce less reproductive hormones. Right? It's because the ovaries that as you age, the ovaries start to shrink down and lose its function. So it hasn't produced enough reproductive hormone. So what sort of hormone is that? So the body begins to undergo several changes in response to lower level of estrogen. Or you may think of just one hormone that causing that. No, that's all the hormone actually. Estrogen, progesterone, testosterone, follicle stimulating hormone, which is we call FSH, sorry, and LH, 2019 hormone. So one of the most notable change in the loss of active ovarian follicles. So is the ovarian follicles. Ovarian follicles, what does it do? Ovarian follicles are the structure that produce and release eggs from the ovary wall. So it allow the menstruation and fertility. So when you release the eggs, so the fertility will happen and menstruation will happen. Without this ovarian follicles, nothing would happen. Okay, it's mainly this ovarian follicle change and loss its active function. I hope that makes sense to you. So most women first notice frequency of their period becoming less consistent as the flow becomes heavier and longer. Now you may get your period once a month, right? But when we first got into menopause, your period, Mijam Gulu, am I right? Sorry, I'm not very good in pronouncing. You heal this from Israel. Thank you for being here and joining us. Cool. Okay, let's keep going. Now, when it comes to menopause, and women will suffer from the very early symptom is you get your period longer. What I mean longer is it start to get irregular. Irregular normally happen with if you get 28 days once a month. Now it will extend, it will skip 1 or 2. It get longer. It may extend to 40 days. Then the next time it may still the same, 28 days. And then it come to 3 months, once every 3 months. And I come to irregular first. But tend to take longer to have a period. Then when you have a period, the amount of your bleeding is heavier. It got heavier. Then what else? And also, the period lasts longer. It may just 4 or 5 days in usual. It can be 7 days. It can be 7 days. So in all your bleeding menstruations or out of balance, it's not normal anymore. It's irregular. Okay. So this usually happen in the when you're 40s, like between 40 to, or it can be between 42, 3 to 49. Okay. Then again, when this happens, you start to experience hot flashes, sweaty, especially at night time, right? Some pain. And those things may last. Hot flashes may last for 6 months to 5 years, and some up to 10 years or over 10 years. But most people, when they last more than 10 years, the frequency of hot flashes actually decrease, but they never stop. They get less. They just happen sometimes, but they still get it. So that's very, very annoying. Which in the beginning they may get 1 or 2 or even 3, 4 every hour, the frequency of hot flashes. But as they go, it got better and better and better. But it may still happen once a week or once every 2 weeks, once a month, even after 10 years. But most people are between 6 months to 5 years. And then it gradually wear off. The body get used to it. The hormone rebalance again. When we say balance is the hormone one produce up there, the other one produce up there. Between those, they need to be balanced. When it comes to menopause, the hormone produced less. It used to be that way, now it's that way. And the other one used to be that way too, now it's that way. And in this lower level, they need to be balanced. Once on a higher level, they balance, you find. When it comes to lower level, between them, the level, they balance, and then you find. You won't get hot flashes. It's when they reduce the hormone produced, one is higher, the other, they can't come to a balance. That is what the causing problem. That was the causing problem. So another thing that with we see a lot in the younger people, like 20 something, 30 something, they start to get hot flushes, and women, and they come to us for infertility treatment. That is because the ovaries start to get failure. You know, the ovaries are not producing hormone and eggs properly, and then they will have a symptom of hot flushes, and that's common when they have a egg quality issues. And yes, how do you know that? How do you know that? The only way is run some blood tests, right? In Chinese medicine, of course, this may be insufficiency, okay, but it's not just insufficiency. Now, common cause of induced menopause include like surgical removal of the ovaries. Remove the ovaries, that it happened for hot flushes. If you have a problem in the ovaries, like probably cancer, tumor, and you decide to remove it, and when you remove the ovaries when you're 30s or 30 something or just about 40, then it brings you to menopause earlier. Once you remove your ovaries, it can't produce all those hormones that we just mentioned. Then you will start quickly go into menopause and you suffer from hot flushes. Of course, they do hormone replacement. Yeah. And hormone replacement has a side effect. It will cause breast cancer. It will cause breast cancer. It will cause other cancer too. Okay, so you have to be very careful, people on hormone replacement. But most people will go to hormone replacement. Yeah, most people will go to hormone replacement, but they didn't notice, they didn't realize that it may cause cancer. Now, we mentioned that even though some people on hormone replacement, they cause hot flushes too. They cause hot flushes too. Okay, and pelvic radiation will bring you to menopause and cause hot flushes. Pelvic injury. When you have pelvic injury that severely damage or destroy the ovaries, you see all go to ovaries. Anything that harm ovaries, that stop or decrease the hormone producing, then it lead you to menopause and hot flushes. Okay, so when it comes to hot flushes, one of the things very, very clear that causing that is menopause, and that is because the ovaries impact. The cause is because the ovaries damage or ovaries out of balance. Put it that way. So it's easier for us to understand right now. So what about male? Now male have hot flushes too. Now in this day, we call menopause is female menopause, right? Now it's male menopause. It happened. That's because it comes to a certain age, the hormone in male body is out of balance, and male get hot flushes too. That happened. Not many cases, but it happened too. Apart from this, is very clear that hormone out of balance that causing hot flashes. Otherwise, it is not exactly clear what causes hot flashes. So there are many other reasons. Okay, but when it comes to acupuncture in Chinese medicine, put it down to too much heat in the body or this indeficiency. Those are more common when it comes to hot flashes. Heat too much in the heat. Yin and yang. Yang is hot. Yin is cold. When yin reduce, yang become more, and then you get hot flashes. And there's another one. If you're an acupuncturist, I want to share with you. When yang deficiency, it comes to the woman's very cold. At the meantime, they got hot flashes. They're afraid of cold. They afraid of hot when they get hot flashes. And any other times, without hot flashes, when there is no hot flashes happen, and they feel cold all the time, they need to drink warm water. They love heat, love warm. And the heat and warm doesn't seem to impact with the hot flashes. They feel comfortable with hot. But only when the hot flashes happen and they have to take out the blanket. As soon as the hot flashes win, and they have to put up the blanket and get the hot heat pack again. And this is more like the yang deficiency of hot flashes. So it's very different. So most people will think of, well, hot flashes is there's too much heat, we have to clear the heat, or hot flashes is because of yin deficiency, we have to nourishing the yin. But they are different when it comes to yang deficiency. Of course, there is another one called yin and yang, both deficiencies that can cause hot flashes too. Okay, now when it comes to treatment, we can talk about it more and how do we treat it with acupuncture and Chinese medicines. And tomorrow we're gonna talk about what trigger hot flashes. Those diagnoses I just mentioned about yin deficiency, yang deficiency, excess of heat, they are all according to Chinese medicines. They're not in Western medicines. Okay, but in Western medicine, it's very clear that menopause causes hot flashes. And we know it too. And we do agree with that. As a Chinese medicine practitioner, we do agree with that. And we do understand that. Okay, tomorrow we're going to talk about hot flashes triggers. What trigger hot flashes? Okay, right, that's it for today. Send you Veronica send you a messenger with a case of suspect RA. Okay, yep, I'll check on it. Veronica, no problem. I have not checked it yet, but I will. Thank you. Right, that's it for today, and leave your comment down there if you have any question, and as well as let us know if you have any patient, if you're a practitioner, if you have any patient who suffers from hot flashes, what's diagnosed, how bad is it, how do you treat it? Share with us. And if you're a patient, if you're on our page, my clinic page, please leave your comment down there if you suffer from hot flashes. What kind of hot flashes is that? And what's the symptom? When it happened? And or if you have family members who suffer from hot flashes, do you know the cause? Put it down there and let us know what triggered it, what caused it, and what sort of treatment do they take. Are they getting better now, or they are not at all? Something like that. Well, thank you very much, and yeah, you guys have a good day, and see you tomorrow. Bye bye.